I'm going to cover the post-op instructions for rhinoplasty procedure. I'm going to cover everything that you get in your post-op goodie bag and what we expect you to be doing at home afterwards. So like I said, you get your little care package from us that has everything in it to get you started with your recovery at home. So the first thing in here is going to be Dr. Frankel's card with his cell phone number. He likes all of his surgical patients to have this. If you have any issues, questions, concerns after hours and you can't reach us in the office, then you can reach out to him directly. Next thing in here is arnica. So arnica is a natural supplement for bruising and swelling. We give it to all of our surgical patients, and along with the arnica inside your goodie bag is a colorful piece of paper. So this paper right here, it has the directions for the arnica on it. So you're going to take 2 tablets 3 times a day, starting the day after your procedure. So that's a total of 6 tablets a day. Seems like a lot, but they're just little white tablets. You'll put them underneath your tongue and they dissolve. Bruising and swelling is to be expected after your procedure, typically getting the worst around day 2, day 3, and then gradually getting better from there. So we do strongly encourage patients to take this afterwards. The next thing in here is ice packs. So icing is great after your procedure. We encourage patients to ice, especially underneath your eyes, over here right next to your nose. With the cast on it, it's kind of hard for the ice to go through your cast, but we do want you to ice at least the first 3 days afterwards. Our only requirement with icing is that you ice 20 minutes on, 40 minutes off, so it ends up being about once an hour for 20 minutes that you can ice after your procedure. The next thing in here is bacitracin ointment. So with this ointment, you're going to have your suture line right underneath your nose right here. So we're going to have you apply ointment. You'll have some tape over the area initially until your cast comes off, but then once your cast comes off, we'll have you apply this to that area where your suture line will be afterwards, just to kind of further help with healing. Next thing, very important things, are going to be your nasal sprays. So you get 2 nasal sprays in your care package. This one is just saline, and then one is Afrin, which is a medicated nasal spray. So with the saline, we want you to start using this the day of your procedure, even once you get home. You should just be using it frequently throughout the day. You're just put it up each side and squirt some up there. It just kind of helps to flush everything out and keep, your nose open. So with this, you should be doing it every 1 to 2 hours while you're awake. So of course, if you're napping or if you're sleeping at night, we don't expect you to wake up and do it, but you should be doing it as much as possible when you are awake throughout the day. And then the next thing is Afrin. So with the Afrin, if you do not have splints inside your nose, you're going to be using this continuously 3 times a day for only the first 3 days. And then if you do have splints in your nose, you're not going to use the Afrin routinely. It's going to just be if you're having any extra bleeding, then we'll have you use it. So most important thing with this, like I said, is after 3 days, you should no longer be using this anymore. And the last thing in here, we just give you some gauze. So when you leave us the day of your procedure, we're going to have gauze folded up underneath your nose, and it'll just be taped to your face right here. It's called a drip pad. So all it's meant to do is just help catch any bloody drainage that you might be having, to keep your clothes clean, keep bedding clean. So we'll have you maintain that, and then we'll also have you, track how often you're having to change the drip pad afterwards. So if you're continually having to change it like multiple times within a half hour, so if you're 3 to 4 times within 30 minutes you're changing it because it's completely, is blood soaked, then you're probably changing it a little bit too much, so we would have you use your Afrin. Now, if you're just changing it because you want to change it and maybe you're just like this, I just want to get a clean one on there, that's not counting as, excessive bleeding. So that was just something we would have you track for the first 24 hours. After the first 24 hours, you don't necessarily need the drip pad anymore. You shouldn't have too much draining after that point. So that'll just be something we have you maintain for the first 24 hours after your procedure. And we'll also give you some tape that we'll tape it to your face with, and we will also show whoever is with you how to put it on. And then the other thing you're going to get is the procedure-specific rhinoplasty instructions, and then you're also going to get a post-op pain management schedule. So starting with the post-op pain management schedule, tell all patients, just if you follow this, you know, stay on top of your pain and really help keep your pain at bay. So essentially what this paper is doing is just giving you an example of how you can alternate Tylenol and Motrin back and forth. So you're taking something every 3 hours, which is what we strongly encourage patients to do. I know most times patients are like, I'm not supposed to take ibuprofen after your procedure. It is okay after rhinoplasty to take it. Like I said, we do want you alternating it to stay on top of your pain with Tylenol. So we do give you stronger pain medicine, give you Percocet for pain afterwards. So this will show you how you can essentially take 1 Tylenol and 1 Percocet, or maybe you don't want to take any Percocet and just take 2 Tylenol. So this paper goes over in great detail how to go about managing your pain afterwards. Next is the procedure-specific rhinoplasty post-op instructions. So it goes over your daily care, it goes over your things to avoid, everything you need to know for after your procedure. I'm going to touch on the key things. Most of the daily care, all of the daily care actually that I went over is in here, so you can also reference it written down as well as this video. Just to point out, after your procedure, we do not want you blowing your nose for 7 days afterwards. So same thing with sneezing. Now, can't necessarily prevent sneezing all the time, so if you do have to sneeze afterwards, we want you to sneeze with your mouth open, wide open. That way there's not that excessive force coming through your nose when you sneeze. Now, activity-wise, so you shouldn't be lifting anything heavy, doing any strenuous activity after your procedure. More so strenuous activity for at least 4 weeks. You should not be doing anything strenuous. So strenuous meaning raising your heart rate, raising your blood pressure, getting you out of breath. We don't want you participating in anything like that. So for example, maybe the first week after your procedure, you should just be doing things around the house. So no more than just walking around the house, maybe doing some light things around the house, but nothing more than that. The second week, maybe you're going for a walk outside if you're comfortable with that, just a gentle walk around the neighborhood. The third week, maybe more of a gentle hike. And then the fourth week, if you get on a stationary bike or on the treadmill and you're just kind of easing your way back into things. As you can see, that just kind of shows how you're gradually increasing your activity level over time, but you should avoid from anything strenuous for 4 weeks. Same thing if you play contact sports. We don't want you participating in any contact sports for 3 months after your procedure. In terms of your cast, you will have a cast on your nose after your procedure. Everybody always asks, our number one question is, can I get my cast wet? Absolutely, you can get your cast wet. We do encourage that you get your cast wet. This helps with taking your cast off at 1 week, so don't be afraid. You shouldn't necessarily put your face directly in a stream of water and let the water soak your cast, but getting it wet is appropriate, and we do want you to do that over the first week. And then when we see you at 1 week, your cast will come off, and your sutures will also come out at that time. Now, most importantly, Dr. Frankel will cover this with you as well during your consultation, is if he thinks that you will or will not be able to wear glasses afterwards, and we will also confirm that with you before you leave, is if you are or are not allowed to wear glasses. Most cases, patients aren't able to wear glasses for 6 weeks after their procedure. We just don't want the glasses sitting right here over the bridge of your nose. So like I said, we'll clarify that with you before you leave our center that day. After your procedure, we do want you sleeping elevated at least 30 to 45 degrees. So have some pillows propped up behind you, or if you're sleeping in a recliner or on the couch, we just want to make sure that you're nice and propped up for at least the first week. It'll just help to keep you comfortable at night and also help with your swelling, and then also with your breathing at night. So that is the majority, if not all, of your post-op care after the rhinoplasty. You will receive all of these things from our office. And after you look them over, if you're still not clear about something, you can always reach out at any time, and we're always here to help.